measure depression and mania. Mania means too much happy state. Antidepressant drugs are also used in sad mood, loss of interest, pleasure, low energy, worthlessness, guilt, psychomotor retardation, agitation, change in appetite, sleep, melancholic, suicidal thoughts. And in bipolar disorders. Bipolar disorders means depression and after some time mania. One time depression and second time mania. Like changing. Moods are changing in depression and mania. These drugs can elevate mood in depressive illness, and antidepressant drugs affect monoaminergic transmission in the brain in one way or other way. What are the classifications of antidepressant drugs? And which drugs we include in these classifications and what are their uses and side effects we will discuss in this video. So, classification of antidepressant drugs. Classification. It mainly divided into 4 or 5 groups. Nowadays we divided antidepressant drugs in 8 groups. First one is reversible inhibitors of MAO. Reversible inhibition of MAO, monoamine oxidase inhibitors, mostly A. There are 2 types, MAOA and MAOB. Second group is tricyclic antidepressants. Third group is selective serotonin reuptake inhibitors or SSRI. SSRI, selective serotonin reuptake inhibitors. Fourth group is atypical antidepressants. These are main 4 groups. Another groups are further divided from atypical antidepressants. So, fifth group is SNRI, which is selective and norepinephrine reuptake inhibitors. Selective and norepinephrine reuptake inhibitors. Sixth group is NDRI. NDRI. What is NDRI? NDRI is norepinephrine and dopamine reuptake inhibitors. Norepinephrine and dopamine reuptake inhibitors. Seventh group is NASSA. NASSA. What is NASSA? It is non-adrenergic and specific serotenergic antidepressants. Noradrenergic, and specific serotonergic. Antidepressants drugs. Eighth and last group is NRI. NRI is non-adrenaline reuptake inhibitors. Noradrenaline reuptake inhibitors. In reversible inhibitors of MAO, monoamine oxidase inhibitors, includes moclobemide and chlorgyline. Second group is tricyclic antidepressants. In tricyclic antidepressants, they include, or they divided into two types: norepinephrine 5-HT and norepinephrine reuptake. In norepinephrine 5-HT, drugs are imipramine and amitriptyline. And in norepinephrine reuptake, drugs are diazepamine and amoxapine. Third group is SSRI. Selective serotonin reuptake inhibitors include fluoxetine and fluvoxamine. It includes citalopram etc. Fourth group is atypical antidepressants. Atypical antidepressants includes trazodone and mirtazapine. Fifth group is selective and norepinephrine reuptake inhibitors SNRI. It includes venlafaxine, and it includes duloxetine or duloxetine. Next group is NDRI, norepinephrine and dopamine reuptake inhibitors. It includes bupropion. Next group is NASSA, NASSA, non-adrenergic and specific serotenergic antidepressant drugs. It includes mirtazapine, which is a typical antidepressant. Mirtazapine. Last group is NRI, noradrenaline reuptake inhibitors. Drug is reboxetine. NRI group includes 5-HT antagonist, 5-HT2 antagonist inhibitors. It includes trazodone and nifazodone. Further about antidepressant drugs, we will study in another video. Thank you for watching my video. Don't forget to subscribe and share.